Hello and welcome. I'm Dr. Derisavifard. Percutaneous nerve evaluation, or PNE. Here I'm going to help you understand what that is and what to expect during, after, and even before the procedure. At the end, we'll review some common questions and their answers. So let's get started. A PNE is simply a nerve test. The purpose of the test is to stimulate the nerves in your pelvis that communicate with your bladder and bowels over a few days. The goal is to see if you have improvement in your symptoms like urgency, frequency, and incontinence episodes. 75% of patients have a positive PNE response, which we define as at least a 50% improvement in symptoms. And nearly 90% of patients who go on to the permanent device implantation continue to have excellent results. The best part is there is nothing permanent about the test phase, and it has very minimal long-term risks. It doesn't work or suit you, we move on. But if it does, it can be life-changing. The test is based on the principles of sacral neuromodulation. This is a type of therapy that's been in use for over 20 years and has been well studied. By delivering electrical signals to your pelvic nerves, it calms them down so your bladder and bowels are relaxed. I commonly tell patients to think of them like noise-canceling headphones for your bladder and bowels. Before the procedure, you'll need to complete a voiding diary for 3 days. This is a log that you will need to keep to establish a baseline of symptoms. You shouldn't change your behaviors for the sake of the diary. It's in your best interest to be honest and thorough. For urinary patients, it's important to report the number of daytime and overnight trips to the bathroom to urinate. Be sure to include accidents as well. The same can be said about fecal incontinence patients, but focusing on your bowel movements. Make sure to bring this with you on the day of your procedure. We'll need to scan it into your chart. If you're taking a blood thinner, we'll need to have you stop taking it at least 5 days before. One exception is aspirin, which you can continue taking. The procedure is done in the office with local anesthesia. It's generally a 1-hour appointment. Because you're not going to sleep, you can come by yourself and drive afterwards. But if possible, it's always nice to come with a buddy. I would also recommend wearing loose-fitting clothing that you can easily change back into afterwards. When you arrive, we will have you change into a gown and position you on your stomach on the procedure table. We will expose your buttock and lower back and prep the area with a cleaning solution. Sterile drapes will be placed to keep the area clean. Please be mindful to keep your arms above the level of your chest. Movement on your part can contaminate our sterile field. I will then take measurements to establish where to place my needles. This may or may not include X-ray. Then I will inject local anesthetic to your lower back before introducing the spinal needles, one on each side, near your S3 nerve root. Once in good position, I will send test electrical pulses through the needle to confirm we are in the right spot. I will ask you at that point to tell me what you're feeling. By doing so, the goal is to get you to feel a sensation of tingling or buzzing anywhere between the vaginal or scrotal area to your anus or rectum. I'll be looking for anal and toe reflexes as well. Then, I'll introduce the temporary leads and remove the needle. The leads will be connected to an external stimulator device and everything will be secured to your back with an adhesive dressing. Finally, the device will be turned on and the appropriate settings determined. That's it. We will turn on and optimize the device before sending you home. Most patients notice improvement within the day. During the test phase, you will need to fill out a second voiding diary to track your symptoms. Remember, we're looking for 50% improvement. For follow-up, we'll see you back in 3 to 5 days, at which point we'll review your voiding diary and remove your test leads. Don't worry about the lead removal, it takes less than a minute, and most patients don't even feel it. In fact, if the test goes well, you may not be ready to say goodbye to the device at all. We'll also take that time to review the next steps for implantation. Let's answer some questions for you about PNEs. Number 1, what are the associated risks? Hardly any. This is a temporary device that is completely removed at follow-up. If for any reason the stimulation is uncomfortable, we can just turn the device off. Number 2, what restrictions do I have? Please try to take it easy during your test week. No exercise or heavy lifting. Be mindful your clothes are loose-fitting. You may bend over, climb stairs, and go about your other daily activities as you usually would. Also, please take frontal showers and minimize contact of water with the device. Question 3. My dressing is coming loose. We'll send you home with some extra supplies to reinforce anything loose. Please do not pull at the device or remove anything because it could dislodge the lead and negatively impact your test. We'll also be calling you to check in, so you won't be managing the device alone. Please remember we're always available for you at any time if you have questions or concerns. Until next time, be well.